Hello. I want to thank CPHA and my nominees for this honor. Working in public health can be isolating at times, and like being in a fishbowl at other times. Results can be seen very quickly or may take decades to show even small progress. Our work and messaging can elicit both praise and scorn. But whatever we do, especially if it is done well, we do as part of a team of many public health disciplines working with intersectoral partners and community organizations. Part of the practice of public health, included in our core competencies, is the ability to recognize when the situation and topic requires us to take the lead, when to support others to lead, or when to cheer from the sidelines in order to maximize the chance for success. Public health is more than a team sport. In fact, it's more like collaborative gaming, where we all work together with varying skills and abilities toward a common purpose. To that end, I must share this award with the many collaborators and team members that have worked with me in the various projects and initiatives mentioned in my nomination. From the wonderful and talented staff in Saskatoon Public Health and the Public Health Observatory, to my peers in the Urban Public Health Network, or my friends and colleagues on the various boards and committees I've been involved with locally, provincially, nationally, or internationally. I have witnessed a common desire and purpose that drives us to work in this field, and that is to improve population health and health equity. While there are many reasons I gravitated to public health, this unity of purpose and collaborative spirit have made this a truly rewarding and inspiring career, and one which will always be a part of my life, whether that be in service, academia, or volunteer capacities. This was made very clear to me early on in my career. I remember back in the late 1990s and early 2000s, staff coming to me with data that showed how poverty was driving so many of our health status problems in the community, and in subsequent analysis, illuminating how this poverty was racialized. I realized then that our efforts to improve population health would only be scratching the surface if we did not make poverty reduction and ending racism and stigma our main goals, guiding all our work in public health, both for our own programs and through advocating for evidence-informed policies in health and other sectors. It was a bit daunting, but it became the big dot measure that guided our work and the lens through which other work was viewed. This has also been the case with the response to COVID. This pandemic has shown us the cracks in our society as it has played out differently across subpopulations and social systems. The way forward for us is clear. Public health needs to continue pressing for a health in all policies approach and all of government response to this crisis to guide a smooth, equitable, and just recovery that makes us stronger and more resilient on the other side. While, as always, public health gains its credibility in how we're able to manage and contain emerging communicable disease threats, between crises and even in our response to the immediate crisis, our work on health equity, the social determinants of health, and environmental sustainability need to be our bedrock and our overarching priority. This can only be done through collaboration and partnership, with public health taking on whatever role is necessary to best accomplish the goal. We will get through this. But do we have the resolve to get through this together and emerge stronger with a better set of evidence-informed policies and programs to face future strains on society? I'm talking about policies and programs like a strengthened social safety net and poverty reduction, supporting programs such as a basic income guarantee and jobs that pay a living wage with appropriate benefits and sick leave, affordable and sustainable housing, comprehensive harm reduction programming coupled with decriminalization of illicit drugs, and low barrier supports and services with a trauma-informed care approach to those with addictions. Investments in early childhood development, including subsidized daycare, anti-racism and stigma initiatives, implementation of the Truth and Reconciliation Commission calls to action and the United Nations Declaration on the Rights of Indigenous Peoples in Canada, tackling climate change through a green recovery, and of course, investments in a strong public health system at all levels. This is the foundational work of public health and what drives our population health approach. It influences how we deliver our many programs and our advocacy efforts for policies that improve health at all levels of government. It's also embedded in CPHA's mission to enhance the health of people in Canada and to contribute to a healthier and more equitable world. It is not easy work, but it is made much more enjoyable by doing it together and working with our partners. That is our responsibility. That is our calling, and that's what drives us. It has been my privilege to be part of a movement that strives to make progress on these goals, and I'm humbled to be counted among those who have received this award in the past and hope to continue this work for as long as I'm able. So thank you once again.